Last night, the 7 investigators exposed how an alarming number of psychiatric patient deaths were never questioned by state watchdogs.
Well, tonight, that investigation is spurring 2 lawmakers to take action.
7 investigator Ross Jones is here right now with the very latest. Ross.
Carol and Dave, good evening. 2 Lansing lawmakers from 2 different parties agree on this. The deaths we exposed shouldn't be overlooked by state regulators. Tonight, each is preparing to change Michigan law to ensure that they aren't.
We need to find out why it's happening and if we could have done something differently so that the next one doesn't happen.
Senate Minority Leader Jim Ananich is taking action tonight in response to a 7 Action News investigation revealing that scores of psychiatric deaths went unquestioned by state watchdogs for years.
Because of the work that you and the station did, I knew there was a problem, but I didn't know how severe the problem was.
As we first reported last night, the state has required psychiatric hospitals at licenses to report each time a patient dies, whether it happens inside the hospital or within 2 days of being released. And since 2016, 151 deaths have been reported, many of them due to natural causes, but many others clearly not, from patients who took their lives just hours after a hospital released them to those who committed suicide in the hospital itself. Alarming and sometimes suspicious deaths that left family members grasping for answers that never came.
People are dropping the ball. Nobody's being held accountable. And I can't get my son back. But I want to stop this from happening to another family.
This week, Senator Ananich introduced Senate Bill 813, requiring the Department of Licensing and Regulatory Affairs, or LARA, to investigate every death that's the result of suicide, as well as those where the cause is reported as unknown.
We need to find out why it's happening and if we could have done something differently so that the next one doesn't happen.
That is our job as legislators, to make sure that we get this right for them.
Over in the State House, Republican Phil Green is introducing a bill of his own. His would require even more reporting from hospitals each time a patient dies, requiring that hospitals report deaths occurring within 30 days of release instead of just 2.
This would allow us to start seeing if there's some patterns, whether it's a hospital, whether it's a doctor, or maybe it's a drug.
The most significant change in Green's bill, moving authority from LARA to the Department of Health and Human Services, which he says is better suited to investigate psychiatric patient deaths.
They have 5 state hospitals. The department is the expert. So let's require the department to do the investigation.
Both lawmakers, one a Democrat, the other a Republican, say they're open to working together to make sure deaths like these don't happen in the dark.
I just appreciate you and the work you did on this. I think people need to be aware this is a problem.
Senator Ananich's bill was introduced on Wednesday. A spokesman for the Department of Licensing and Regulatory Affairs says the department has had conversations with the senator about his bill and is eager to continue them. Representative Green's bill is expected to be introduced on Tuesday.
Do we know if that department is even equipped to investigate these cases?
They have the capacity to. Well, since they haven't been investigating them already, we don't really know, but that is certainly the concern. If you've got all these deaths that going forward need to be investigated, will they have the bodies? Will they know exactly what they're supposed to be asking for? We don't know, but these are questions they need answered before these bills can proceed.
Something the legislature will be able to act on, perhaps. Ross, thank you.